So excited to unveil the changes that we've made here at Howard Brown. What we're going to be showing you in a little bit is changes that we've made to the center that are going to allow us to serve 30% more patients. We're aiming to serve more than 3,000 additional need patients in the organization, and this expansion is going to help us do that. We worked tremendously hard with every aspect of this plan, every detail. I really have to also commend the facility staff, the whole team that's been working very hard to stage and figure out how to do this, to make sure that this building, that we get maximum productivity, maximum service out of this unique space here at 4025 North Sheridan. The aims of this project were really pretty simple. We wanted to create greater access to culturally competent LGBT affirming care. We wanted to reduce wait times for our patients. We wanted to serve more people, but most importantly, we wanted to make sure that the experience of receiving health care is pleasant, inviting, and barrier-free. And I'm proud to say that we achieved all of our goals and then some. More patients will certainly be served, and that we've already seen that trend begin. But how we serve them is also important. And everyone who walks through the door, it's our goal to make sure that everyone who walks through the door is served with LGBT-affirming care in a professional and dignifying environment. The changes begin right now in this atrium. So where you're standing, we've cleared out the chairs, but on a normal day, there's 30 chairs, and this is the new patient wait room. Which is for us, is pretty exciting. It's a big innovation. You see, before our patient wait room was in an interior, windowless room. But now our patients are going to be basked in natural lights next to this beautiful mosaic. And really, we want to uplift our patients. We want to make sure that everyone who walks through the door is affirmed. And affirmed in their choice to seek care. And for us, the choice to seek care is not just an individual choice. It's a choice to really serve the community. So we believe really that the act of taking care of each other and taking care of ourselves is advocacy, and it's uplifting our community. So we're so excited that the transformation begins with the wait room. We've converted the old community room that's right behind us into 5 patient service representative stations. This is where individuals will give their confidential income information, where they'll discuss insurance if they have it, where we'll help them enroll in insurance if they're not enrolled, and where we'll schedule their appointments. So that space has been modified. We have 4 examination rooms behind the mosaic, which you'll see in a little bit. And we're also, actually at the end of our little ceremony, we're actually going to, for anyone that wants to stick around and see it, we're going to be conducting a quick tour for folks to see not only the new space, but our existing clinic with 10 examination rooms and our behavioral health clinic. What's this going to do? This is so much more than just construction. So, we wanted you to understand that, we really were thinking about, this is more than just drywall and some plumbing. As a leader in transgender health, serving more than 1,600 transgender patients, for example, we estimate that in the new examination rooms, 3 in 20 patients accessing care will receive hormone replacement therapy in these rooms. So it's an important part of our efforts around transgender health. We estimate, as our primary care practice right now is numbering about 8,000, and it's growing. We estimate that 1 in 20 patients in these rooms will be treated for diabetes. In the rooms that we'll be inaugurating, we estimate that 1 in 5 will receive care for hypertension and other risks for cardiovascular disease. Given the difficulties that many people in the LGBT community face in receiving care in other settings, we see it as our mission to provide the most affirming, the most welcoming care to everyone that walks through the door, particularly the LGBT community. Today, Howard Brown is a full spectrum clinic. So we've been known for our sexual health work, and that's still an important part of this building and the work that we do here. But embedded in the very same clinic is a full spectrum primary care clinic, providing everything from family planning to primary care, in our infectious disease work. We have on staff a full-time pediatrician, all the way to a board-certified gerontologist, who you'll hear from in a few minutes. So our patient volume has already grown. So in the last 7 months, we've seen more than 2,200 new patients walk through the doors. So already the transformation has begun. So these rooms could not have come at a more auspicious time. And with open enrollment beginning on November 15th, just around the corner, we're going to be doing our work again to make sure that people get assistance enrolling into the marketplace if they need that help. This was no easy feat, doing this transformation, because we not only did this construction, it looked small, but it was really a significant construction for us because we kept the doors open. So I want to really give a shout out to the whole clinical team, to our facility staff, our patient service representatives, everyone that helped to make sure that we could do this and stage it around without interrupting our regular schedule one day. Again, I want to thank the state of Illinois, and particularly our state officials who made this possible. The award that we received not only helped us with the construction, but also helped us patch up the roof, literally right here, and helped us put in a new boiler. And as we are thinking of, as we start getting colder seasons, having weatherized building is so important. So to tell you more about the impact of our clinical space is our Chief Clinical Officer, Dr. Margaret Colton.
What does it mean to have more exam rooms? Going from 9 exam rooms to 13 exam rooms allows us to see a full 8,000 more office visits in the next year. That translates to 80,000 visits in the 10-year lifespan of the rooms, 80 to 100,000 visits. So it's an amazing, it allows us an amazing expansion in terms of the volume of services that we can provide. Also, throughout this, as David spoke to, the fact that we've been open through the entire construction. While it seems like a small project, having full services going while having full construction in all of the patient-facing areas has been a tremendous feat, an accomplishment for facilities, for our medical providers, for nursing, for our medical assistants. It's impacted our call center. It's impacted everyone in the whole building, and they've amazingly provided the same incredible level of service throughout the entire construction. So I really want to give a strong... Members of the medical team could raise their hands so everybody kind of knows who you are. That means so, and I just want to thank our staff who's been incredible through this to minimize the impact in the short term on our patient care. In the long term, what's going to happen, what I want to share with you is the privilege that we have every single day working here, which is that I know for a fact that today, for example, our medical providers will be seeing a patient that will probably be learning of their HIV positive status for the first time today. Today, we will probably have patients in these rooms learning, who have worked up the courage to come forward to access care, sometimes for years. So sometimes we have patients who have literally thought about coming in for care for years, and today is the day that they'll be doing that. So we are really privileged to be able to impact patients in this incredible way. And I really want to thank the state of Illinois for making this possible. It is an amazing, amazing gift. And I want to introduce our state representative, Sarah Feigenholz, who we're so excited to have here today.
Well, first of all, I want to thank David and Magda for doing such a great job, and my colleagues, Representative Greg Harris, Alderman Kappelman, and Alderman Tunney, 3 guys who were the first on the beach. I mean, I don't want to sound like we're a bunch of dinosaurs here. I'm trying to be really, really careful. That includes you, David. But these are not relationships that are week old. These are not relationships that are months or years old. These are relationships that are decades old. And those of us who grew up in the community and watched Howard Brown break ground in this facility knew that it meant that we were making a lifelong commitment to the people of this community. It was historically a place, it was the first anonymous HIV testing center in the country. Is that true? Was it in the country?
Let's say it is.
Okay. But the bottom line is, it was a source of pride. It was a source of pride for our community. And just by being people on the street, we knew how important this place was, not just for people living in Lakeview, but for people who came to Lakeview because this is where they felt safe. We knew that no matter where they live, as much as we want these kinds of FQHCs and FQHC lookalikes all over the city of Chicago, that we are the neighborhood of big shoulders. This is where people come to feel safe. This is where people come who haven't had the courage to get that first HIV test. This is where people come to find out their status and know that we are going to take care of them. And I am certain that David Munar and Magda will be coming to us for years to come by the grace of God because of who we are and what we represent. And the fact is that we do keep our doors open to everybody. So let's give them a hand. So for every time we are asked as lawmakers, as people, as appropriators, as budget makers, and people who have access to the right people to ask questions about making investments in our community, we are going to fight for resources because we love you and we love what you do. So I also see a very handsome man who stepped into the room who represents our fabulous governor, Pat Quinn. His name is Austin Vedas. Let's make him.